You're watching TVC Breakfast. Sickle cell disease is an inherited hemoglobin disorder comprising sickle cell anemia. And presently, Nigeria leads the world in the number of cases of sickle cell disease. An estimated 150,000 babies are born annually in Nigeria with sickle cell disease, and between 70 to 90% die before age 5. Sickle cell disease is by far the commonest inherited disorder in the world, and 3/4 of cases occur in Africa. As the world prepares to commemorate this year's World Sickle Cell Day with the theme Shine the Light on Sickle Cell, more awareness is needed to improve quality of life for warriors. So I have joining me on Zoom for this discussion the Executive Director and Founder, Sickle Cell Advocacy and Management Initiative, Toyin Adeshola. Toyin, good morning. It's good to have you join me.
Good morning. Thank you very much for having me.
Great. Now, I am always very happy as to how you have been fighting this issue and creating awareness for other people headlong. Now, talk to us. We'll be commemorating the World Sickle Cell Day tomorrow. What should everyone have at the back of his mind?
Well, I think the most important thing is that they should realize that sickle cell is real. Sickle cell is here, and it will always be here if nothing is done about it, which is one, know your genotype. It's very important, and we have to get to a point where it's not just knowing it in one place. We have to go to more than one place because we have issues of false lab reports. So that is it. Just know your genotype. It's very important. And also in terms of, because I think we focus a lot on the awareness part, but we should remember there are already people living with sickle cell going through a lot of challenges. So we have to get to a point that what can we do as stakeholders, whether it's media, whether it's government, whether it's corporate organizations or medical personnel, what can we do to help these people to live good lives? Because we can live well. I mean, it's just unfortunate that our healthcare in this country is not very favorable for us. But with the adequate support and health management procedure, we can live well. I'm 55, so I mean, it's possible for a lot of us to break that myth that but you don't live till 21.
All right. Now, let's see it from the perspective of the family, friends, all that network that is supposed to help. What are the tangible things that we should do all in approach to someone who has sickle cell to help him stand up firm and strong and live his or her life?
Well, I think the first thing we should do is to understand the disorder itself. A lot of us don't understand the pain we go through. They think that we are being hypochondriacs or we're making a mountain out of a molehill, but the pain is real. It's worse than labor pain, lots worse. So people should realize that when somebody is in sickle cell crisis, they need all the support and encouragement. That's not the time to be chastising them, especially parents who get frustrated by funds. That's not the time because it doesn't make things easier for the person. So they need to know the disorder, know how to help that person, manage that person, which is drinking water, making sure they take their meds, avoiding extreme cold, extreme heat, and also avoiding places where or issues where infection will come in. And then also psychological support, because we focus so much on the physical aspects of sickle cell. We don't realize that a lot of times sickle cell warriors, as we call them, go through a lot of mental and emotional challenges, sometimes resulting in addiction to their pain drugs and other complications. So we need to encourage them. We need to empathy. It's not about pity. It's about empathy and just encouraging them that, yes, we're going through this, but I'm here for you. I'm here to listen to your challenges. I'm here to help you whenever you need my help. And I think that will go a long way in helping people, not to stigmatize them, not to say that they are lazy, because what you think is lazy is that the person may be going through some challenges. It doesn't mean that the pain will be visible on our face. Sometimes we're so used to hoping the facial expression of the pain that you don't realize that we're in pain. but it's about supporting them and just showing empathy.
All right, talking about the issue of knowing about the disorder, talk to us basically. How much of awareness is out there from your observation? Because every year we commemorate the World Sickle Cell Day and we talk about it, but how much awareness is out there from what you assess?
Well, it varies. I mean, of course, in the urban areas, there's a lot more awareness. But I think even then, it is skewed awareness because the basic thing we always hear is the AS, don't marry. Why they don't really have a grasp. They just know, oh, they said AS and AS should not marry. But it goes beyond that. It goes beyond AS and AS because there are other genotypes that can also have children with sickle cell. So I think there's need for more explanation. And then, of course, in the rural areas, there's a challenge of translating it into the language they understand because it's backed by a lot of superstition and cultural beliefs. So we're doing good, but we're not doing great. Of course, trying to reach a lot more people takes a lot of funding and all that for us as NGOs. There are a lot of NGOs out there trying to do free genotypes, but even to do the genotype alone, it's costly. It's a bit better than what it was 5 years ago, 10 years ago, but I mean, there's a lot to be done concerning it. And I know that there's a bill in Senate to be able to increase that awareness. We are trying to see what we can do to push its reality, but we still have a way to go.
Okay. Now, the theme for this year is Shine the Light on Sickle Cell. How best can a day like this be commemorated? What do you expect to see?
Okay. Well, more awareness, more warriors, sickle cell warriors coming out to talk about it. Because I always say this quote that he who knows where it hurts knows where it hurts most. He who the shoe pinches knows where it hurts most. So for us as warriors, I'm hoping to see us come out more. I know because of stigma, a lot of us don't want to come out. But when they hear our stories, it's better for them to understand the realities than from secondhand information. But I expect a lot more conversations and a lot more actions, not just by government, because I know we focus a lot on government, but by corporate organizations and also medical personnel in terms of research. We should think of ways to reduce the cost for people with sickle cell and also find ways to also improve research and also newborn screening, which is a challenge for us in Nigeria because it's very expensive. So more conversations and more actions.
All right, you're the founder of Sickle Cell Advocacy and Management Initiative at the center or at your organization. Share with us some of the activities that you carry out on a daily basis and how successful they are turning out and how people are also accepting it.
Yeah. Okay. We have a free clinic, monthly free clinic, which is called Extra Care, and the whole idea was to serve a bridge between the patient and the doctors, because the medical personnel, because we find that because of funds, a lot of them leave going to the hospital till it's too late. And so we have a free clinic where we provide totally free drugs of every kind, free consultations, blood tests, and any other thing that we find necessary as funding complies with us, as it were. And then through that, we also have what we call W Rescue, where we also sometimes support medical bills. And we also have about 35 people on health insurance, because we found that helps a lot reduce the burden on the parents on trying to help the child. So we've tried to put at least 35, but we're thinking of increasing it as funds come in. And then we also do awareness programs. Of course, because of COVID, it's been limited, but we've been able to go to more hinterlands in Lagos and sometimes outskirts to be able to create awareness on sickle cell. Also do free genotypes for a number of people, and then explain to them the importance of knowing their genotype. We just concluded a radio program for a year that we've been running, and we're hoping to continue it again, creating awareness and talking about issues that surround sickle cell and people with sickle cell, just for people to be more informed and break all the myths and the fake news, as it were, concerning sickle cell. And that's what we've been doing so far. And it's been pretty successful, especially with the clinic and the health insurance. We found that it has reduced the burden on the parents and the need to find money to go to hospital, thereby reducing death in terms of sickle cell patients. Yes.
Now, at the level of the organization, in carrying out your activity, what are some of the challenges that you faced that you think some things have to be done differently?
Well, one of the challenges I find is unity, unity of stakeholders in trying to define what we want done, and then collaboration. Sometimes I know everybody thinks about funds and all that, but it's difficult for us to do a lot when there's no funding and there's no opportunity to collaborate. Corporate organizations don't really register sickle cell as a major thing at this point. Sometimes it's a struggle trying to get them to buy into things like this. So you always have to go for grants, which don't always also focus on sickle cell. So those are one of the challenges. Then also, in terms of medication, the cost of medication for our warriors, it's a real challenge for them to be able to afford it. Of course, because of the effects, things have gone up. So you find a lot of times parents don't buy this drug, so we have to supplement that. And then also ignorance on the parents' part. You see, if a number of them tend to neglect or abuse their children because of frustration of finance and lack of understanding of why this person is going through this, and they think that or because they see another person with sickle cell doing a particular way, they think their child should be like that. But everybody's experience with sickle cell is different, so we can't all lump everybody together. So we try and educate them in that manner. And it's been challenging, especially for those who don't speak English or don't understand, but it's something we're trying to communicate as much as possible.
All right. When it comes to government effort to assist and to also create an enabling environment for some of the initiatives like yours, how much of it is forthcoming?
Not much. Unfortunately, not much. I know. The health ministry, the DEX for non-communicable disease, they're trying to do their best. Unfortunately, they themselves don't get as much funding as communicable disease. So in terms of awareness and things like that, not really much. There are a lot of priorities that are put over sickle cell. So it's a continuous conversation that we're trying to engage them to be able to pay more attention, especially Nigeria and its population being the highest burden in the world.
All right. Now, when it comes to, like they say, prevention is better than cure, where should we start from when it comes to the idea of how to prevent sickle cell?
It's about knowing your genotype before you marry,
Okay.
basically. What we believe is important that you know your genotype. And as I said earlier, one of the things we also found out is that even though people know their genotype, sometimes the information they get by the labs are false. So we encourage people to go to more than one lab, a reputable lab. Don't cut corners with cost. There's a saying, penny wise, pound foolish. Sometimes in cutting corners, you don't get the right results and you get yourself into more financial burden. So go to more than one lab. It's very important. And then in knowing your genotype, realize it's more than AS. There's AC. There's different variants. There's beta thalassemia. So it's important that we become aware about these issues, so that when we do decide to get married, we do not force people not to marry, but be informed, and so that you can make the right choice. It's very important to do that when it comes to knowing about sickle cell.
It's really a critical decision one has to take at that point, because a lot of people get very
Emotional.
twined into the issue of love And then when the genotype test is taken, and then it is something you maybe you're advised you're not compatible, but people think about the love that is involved, and they still want to go ahead one way or the other. But we have to leave you here now. Thank you so much for the time, Toyin Adeshola, for giving us insight into all of this, and thank you for what you do to assist others, as well as what you're doing to ensure that things are better for other warriors against sickle cell anemia. Thank you very much.
Thank you.
Great. Right. Tomorrow is World Sickle Cell Day, and we decided to take a look at it from now to